Hi, my name is Cindy Shilling. I'm a student at Malone University. Today I'm going to talk with you about medical errors. At some point, you or someone you know will need medical health care, a surgical procedure, or medication administration. What are your chances of experiencing a medical error? The 2001 Center for Medicare and Medicaid instituted the Quality Initiative for all healthcare providers and facilities. It monitors, analyzes, and interprets quality of care delivered by healthcare providers. Medicare and Medicaid will not reimburse providers or facilities for resulting patient never events or never happen events of hospital-acquired conditions. Never events increase malpractice insurance costs, medical costs, and it may cause medical fatalities. Never events include wrong surgery sites or side, patient suicides, retention of an object post-surgery, discharge infant to a wrong person, nosocomial or in hospital-acquired infections, patient falls, patient trauma, manifestations from poor blood sugar control, and wrong medication or dosage. In 2010, the Affordable Care Act, also known as Obamacare, was enacted. Not only was it made available so that all individuals could have insurance coverage for medical needs, but in addition to that, it was to provide quality, safe health care. This is just a little video clip of what President Obama has to say about medical errors.
Central notion in the Affordable Care Act was we had an inefficient system with a lot of waste that didn't always deliver the kind of quality that was needed, that often put healthcare providers in a box where they wanted to do better for their patients, but financial incentives were skewed the other way. And so the work that we've been able to do is already spurring the kinds of changes that we had hoped for. It's helped reduce hospital readmission rates dramatically. It's a major reason why we've seen 50,000 fewer preventable patient deaths in hospitals. And if you want to know what that means, ask Alicia Cole, who suffers, Alicia's right here, who suffers the long-term effects of a hospital-acquired infection. And she's here today because she doesn't want anybody else to endure what she has. And it's preventable if we set up good practices and financial incentives, reimbursement incentives are.
And that is a very important point, is prevention. Of course, any type and all types of prevention can not only make you a healthier individual, but also help to prevent medical errors. The World Health Organization, WHO, initiates safe surgery, saves lives. 1 in 8 surgeries involve an intraoperative count discrepancy. Foreign body retention may cause many adverse medical consequences or death. Multi-layer team and emergency surgeries increase foreign body retention potentials. Foreign body retention increases morbidity by 50% and mortality by 10%. Technological advances by adding barcodes to surgical items for scanning, and it assists in the counting. Post-surgery retention of foreign bodies might be gauze, scalpels, needles, swabs, sponges, instruments that are remaining in the body after the surgery. Item miscount occurs due to communication failures. X-rays need to be performed, but they're not always conclusive. Documentation is required to report it, and an additional procedure may be necessary to remove the foreign object from the body, and of course this may result in malpractice and death of the patient. Health information technology allows providers to share medical information. We learned about this earlier in our course. Electronic hospital records, or EHRs, may help providers avoid medical errors. The EHR systems need to be user-friendly, use universal medical technology, coding, alert potentials and errors, and protect patient information. It reduces errors related to medication dosages, contraindications, and administration schedules. It can have built-in programs to identify potential never-happen events. Healthcare providers need appropriate training for the best utilization of these systems, and also quality assurance and periodic checks to make sure that these are working properly. Defined by the 2000 Institute of Medicine report, to err is human, as a failure of a planned action to be completed as intended, or the use of a wrong plan to achieve an aim. And this is part of the honesty and full disclosure regarding medical errors. As you can see, that's an x-ray where they have left a foreign body back in the patient. The American Medical Association and Joint Commission recommends all medical errors are reported and full disclosure is made to the patient. Patients and family members need to be aware of the implications of the medical error. Providers fear malpractice, claims, damage reputations, and disciplinary action. Patients may react with anger, sadness, rejection of future treatment, and loss of trust. Providers may suffer from depression, anxiety, substance abuse, and other negative responses to having committed a medical error. Providers can also be held responsible for medical errors committed by their healthcare personnel. Many medical errors go unreported. Medical errors account for 98,000 of preventable deaths and 1 million excess injuries per year. And this is probably a conservative estimate because, as stated, medical errors go unreported. Everyone is responsible for the prevention of medical errors. Mandatory accurate documentation of all health care provided to the patient, because this may become a legal document to support evidence. Use of universal terminology and less abbreviations prevents misinterpretations. Scan the patient's identification band before medication administration or procedures. Review medical records and lab results. Report concerns to appropriate care personnel. And follow the facility protocol and maintain medical ethics. Become a member of your own healthcare team. Ask specific questions. Review your plan of care. Present concerns to your healthcare providers. Have a family member or friends advocate on your behalf. Choose a facility and a healthcare team you trust. Report all medical errors or neglect. Be proactive in stopping medical errors. Thank you.